Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California, 94568, and phone number 408 687 1899. Anytime for any disease, when you are tired of any treatment, please call me for 408 687 1899 for your best opinion or second opinion about your disease, about your treatments. Based on my 52 years of experience in medicine, out of which I was teaching about 26 years in medical colleges, homeopathic medical colleges in India. And after that, since 1997, I'm practicing here in the USA. And mainly my practice is concerned with the homeopathic system of treatment, but though I am also graduated from the Varanasi University uh, for the Ayurvedic system of treatment as well. So, in these lectures, we are regularly discussing the journey of life, journey of sperm, journey of life, how the life was created and how the life was developed. Step by step, when it was in the mother's womb, what were the conditions, how it was developed, and after that, when it came out of mother's womb, and it was known as newborn. And the newborn was having many different problems, and we have already discussed all those problems. What were the problems at that time, and what the medical science is doing for that one. So, in this way, step by step, we are discussing everything about the life, that this life has gone through various problems, various processes, various diseases, and the medical science is taking care of all those diseases step by step. Newborn age, toddler's age, adolescence age, and now we are discussing about the pre-adult age. Though legally it is considered adult, but still mentally, still for your responsibilities, the life is not competent to do all the duties which are assigned at this age group. And mostly we are considering this age group from, you can say, adult age, 14 years of age, mainly the 18 to 35, mostly we consider, and some of the people, they consider it should be limited between 20 to 35 years of age. It depends upon. But in this criteria, there are different problems, there are different responsibilities, and there is a different approach of individual persons towards their responsibilities. And that sometimes when there is a deficiency, inactivity in performing their duties, many things physically, many things mentally come up in the course of this life. And we have named them just like diseases. And medical science is doing their best, whatever they can do to manage all those diseases at this phase. So previously, in our previous lectures in Punjabi, we have discussed about this thing that When a child passes the adolescence age, and at the adolescence age, you know that there are many more hormones are erupting, accelerated, you can say, because they were there. Hormones, man making hormones and female structure making hormones, they were already there. That is why the doctor told you that you have a female child, you have a male child, whatever that from the outside structures. And ultimately, they go on without any uh, excessive variation up to the toddler's age. But when it reaches into the toddler's age, sign and symptoms of the adultery, sign and symptoms of the production of these hormones is accelerated. And because of the acceleration of the production of these hormones, many changes occurs inside the body. So those changes sometimes are acceptable, sometimes are not acceptable, sometimes the person is not prepared for those things mentally and physically. And there are various causes we have already discussed in our previous lectures. There are various causes for the sickness at this phase of life, pre-adult age. So we have discussed previously about the obesity. What are the reasons behind obesity at this age? Overeating, without exercise, living life, sedentary type of lives, eating more sugary things, eating uncontrollable. All these things are, and some of the diets which just like alcoholic things and all these things, which increase the metabolic rate of the body, and ultimately they eat more, and without exercise they become obese. So this is what we have discussed in our previous lectures, that at this age the big thing which comes immediately for a consideration, that is the obesity. And for that we have already told you in these lectures in Punjabi and Hindi previously, that one should be careful so that he can mobilize each and every cell of his body, means to exercise. When you sweat during exercise, it means all the cells of the body has been activated. They are activated. That is why they are exuding the carbon dioxide and all other gases, and through the skin. That is the sweating. But if it is not, then we can just assume that all the cells of the bodies are not activated. That is not considered as exercise, or you can say the minor exercise, the minimum exercise. It depends on the age as well, that how much exercise you need to metabolize your system, metabolize your diet. But here, when you are at a pre-adult age, we recommend that at least you should exercise once in a day, that you have sweat, so that all the systems are working actively, because at this time the body phase is increasing, or the body mass is increasing, activities are increasing, and you need more diet, you need more calories, you need more calories to burn as well. So therefore you need to exercise regularly at this age. Otherwise the condition which is I told you about, the obesity may come up. Excess food which is not metabolized, which is again fixed up as a reserve fat inside your tissues, reserved fat inside your tissues, in each and every tissue. It's not that your chest, your hips, and your tummy and all that, they are having the fat. No, everywhere, even inside the organs, are having the similar quantity ratio of the fats, and that causes problems for the functioning of the internal organs as well. So therefore, if the obesity you see from outside, it means the obesity is still inside as well. So therefore, if the obesity is there, automatically you see the obese peoples are lethargic. The obese peoples are not that much active as the slimming peoples are active, and The same ratio you can apply for the internal organs, that the internal organs are all also not fully active what they should be to function normally, to make this body healthy. Therefore, a normal exercise at the pre-adult age is a must thing to avoid the obesity. And after that, we have considered in these lectures about the diabetes. Some of the cases are are diabetics, that is known as A type of diabetes. That may come from the parents, mother or father, if they are diabetics, and sometimes it may be genetically transmitted to the offsprings, their children's as well. And if those this thing happens in a child's life, even if he is at the pre-adult age, developing normally, but even then this is a genetic problem and needs to be managed time to time, and it's not going away. At that conditions, you have properly to take care, and properly take care not only one time, regularly. You have to make a lifestyle so that you are taking a regular care of your body to metabolize the excess of sugar inside the body so that it remain normal. Because the pancreas is not creating sufficient insulin to metabolize your sugar inside the body. Because everything, whatever you eat carbohydrates, you eat fat, you eat minerals, you eat proteins, fat, and everything, whatever you and the components as a diet you eat, from sak sabji, from wheat, from meat, from eggs, and everything, all these things. And they have the components, the carbohydrates, fat, protein, all these things. And they are also generating the vitamins in that kind. So all these things, when they are uh, you can say assimilated inside the body, when they are digested, means from food they are taken into the bloodstream, means they are digested. So when they are digested, their shape is known as sugar. The different kind of sugar is prepared from the different kind of food style, just like the protein sugar becomes amino acids, amylase, all these things from the different component of the food, they make the sugar, but the name is different for each components of our food. And means I want to convey you that everything whatever you eat, when it is digested, it is converted into the sugar, and the insulin which is produced by the pancreas has a responsibility to make it minimum, to make it usable, to make it at the normal limits, whatever we have considered, that the 80 milligrams per 100 ml of blood. That's the normal component of sugar in our blood. But once after you take food, it depends, it increases the sugar. If you take sugary foods, automatically it will increase the sugar level, the sugar percentage per diet. But if you are not taking sugary foods, but in routine foods you are taking, even then every component is converting into sugar. But that may be of less quantity or less ratio as compared to, and the normal insulin which is produced by the pancreas can cover all these things. But if the person is already having inefficient, insufficient production of the insulin by the pancreas, and sugar is automatically produced by all these components of the food, then automatically it will be having increased ratio, increased percentage in our blood of the sugar. And then we say the diabetics. And these diabetics are considered as A type diabetes and B type diabetes. The A type diabetes is those which you consider is a genetic type of things. When the pancreas is not working, basically when it was originated inside the body, and when it start developing into a normal phase, it is not developed into normal phase to function normally. As I told you, at every 32 weeks, all the organs of the fetus inside the mother's womb, they are competent to perform their duties when they are separated from the mothers. They are competent to do whatever the duty has been assigned to them. But in case of A type of diabetes, yeah, in case of you can say the genetic type of diabetes, that development is not normal. That development is deficient in the to produce the insulin after that. So therefore, those persons who are having this kind of conditions, under development of the pancreas, non-functioning pancreas, all these things, they create A type of sugar. On the other hand, the B type of sugars, overeating, when they are not metabolized normally, and also the insensitivity of the insulin. Insensitivity, even insulin is produced, but that is not acting sufficiently to metabolize the sugar, metabolize the food materials, whatever you are eating and converting into sugar, they are not able to. In this condition, again, the sugar increases in the circulating bloods, and we check it and we see, oh, it's increased. Now there are different measures we adopt. We check the daily circulating sugar inside our blood. We check 3 monthly average by A1C type of test, which gives us an estimation that what was the routine throughout, because every time we cannot check the sugar, every time we cannot pinch our fingers, and but now there are many more devices. You need not to pin the fingers, but there are different devices of the touch. You can do that the same way. This A1C is also a type when we can measure as an average the sugar between 3 months. So in this way, we can, if a person is having genetic type of sugar, needs to be checked every day, daily. Before every meal, he should check his sugar every day and should take the insulin, sufficient quantity of insulin, which can metabolize whatever you eat at this time. But in B type of sugars, which is because of the overeating, because of the lethargic life, because of non-exercising life, sometimes we suffer from the B type of sugar. There are many more number of cases are with the B type of sugars. In these conditions, again, there are many more other medications which can neutralize this excessive sugars from the diet. Just like the homeopathic treatment is also a competent type of treatment for the diabetic patients when it's a B type of sugars. Though we have very good responses in A type of, because we take A type of sugar homeopathically, we take it as under development, because the pancreas was not sufficiently developed. Pancreas was not able to produce sufficient insulin, what was required. So in underdevelopment of cases, in children's, mostly we have medications doing miracles in their life, that the child was born early, 6 monthly or 7 monthly, or 8 months, even before the 280 days, means 40 weeks of the pregnancy, they born early, and there are deficiencies in his life. Same way, we have medications in a homeopathic system of treatments that can bring those children up to the normal level of their age. And the same thing we can consider about the pancreas, that the pancreas is not fully developed as per it should be developed, depending upon the his conditions. Maybe genetic type of things, maybe some other reasons, A type of sugar, when the pancreas is not working normally, or pancreas is not producing sufficient insulin to metabolize your sugar, metabolize your diet, whatever you eat. And we consider it, as I told you, under development. And under development, well, when you treat according to the symptoms, it has a wonderful effect for the development of the pancreatic function. And sometimes it reaches to the extent that we do not need regular medications even for the A type of sugars. So in this way, the second problem, the major problems we have at this age is the sugar. maybe lethargic life, maybe non-exercising life, maybe overeating, maybe eating heavy fatty foods without metabolizing these things, without doing the exercises, or the genetic type of things, and the A type of sugar. So whatever it may be, these are the conditions which we can recognize at this age, that yes, he is a diabetic. He is a diabetic and having diabetes type 1 or diabetes type 2, having a genetic characteristic diabetes, gestational diabetes, and or after that. So these are the simple conditions. We will discuss the diabetes later on. There are many more other reasons and causes, and after that, the treatment process and everything we will discuss later on for all the diseases. But here, today, as a concern is to deal with the, to indicate you what are the problems at this age. After that, we had discussed about the depressions. Mainly, the depression is defined as insufficiency of a person mentally and physically to perform his normal duties. And when you are unable to perform your normal duties, and there is overburden day by day, and then ultimately you feel anxious. It brings anxiety. Oh, yeah. Every day there is a backlog of work. Every day there is a backlog of work. I cannot complete my task, whatever it is for the day. And ultimately, it brings anxiety. And if this anxiety is a long lasting, and you think, no, I will not be able to do that well, ultimately every day by day, your backlog is increasing, and you are becoming insufficient to perform your normal duties and to cover up the backlogs of your responsibilities. Ultimately it brings the depressions. When your mind is unable to perform, to think according to the normal performances, normal duties which are assigned. And on the other hand, the physical body is not able to perform all those duties. So that brings up the ultimately the depressions. After that, we have discussed about if the sedentary life a person is living, if he is eating heavy fatty foods without any exercise, if he is always anxious, in tension, and is unable to perform his normal duties, but he thinks that yes, he is not able to perform his duty. If you do not think carefree, then that's okay. But if you are careful persons, if you are thinking that I'm not able to perform my duties, under those conditions, sometimes the people may suffer from the blood pressures at this age. It's a tension blood pressures. And ultimately, just like in the old age, the reasons behind the blood pressures are different. In the adult age, the reasons behind the blood pressures are different. But at this pre-adult age, the reasons behind this blood pressures are mainly insufficiency work, that you cannot perform your duties normally. Ultimately the tension has increased, or you are taking a fatty heavy diet without any exercise, or you are taking excess of salts, and all these things bring up the hypertensions. And the basic line of this kind of hypertension is the high and this cholesterol. So cholesterol may bring up the blood pressures, may bring up the narrowing of the lumen of the blood vessels, and ultimately narrowing of the coronary arteries in the hearts, and all that, heart attack, this and that, many other things may come up with this one. If you are not exercising, if you are taking heavy diet and not metabolizing normally, without exercise, living a sedentary life, in this condition, all these things may happen. And after that, I told you that at this age, even in the adolescence age, all the hormones, which are separating the female from the males in functions, in physics, we know it, they were separate since birth. We know that this is girl, this is boy, but this is also because of some hormones, and ultimately they start growing. the quantity and concentration inside the blood time to time, and ultimately they are accelerated at the age when they become adolescents, and they are entering into the pre-adult age. These hormones are accelerated and excessive in quantity, and when they are excessive in quantity means their functions, whatever they are to perform, they will perform in excess than the normal. Then they were not performing in that way, they were not behaving in that way in their previous life, but now they are performing. And because of that, and if the normal natural discharges of these hormone is not possible, just like getting marriage, getting marriage is a way to discharge all these excessive hormones in a normal routine, in a natural routine. But if you cannot do that under those conditions, because all peoples are not married at this age, maybe later than that. But if they are married before that, because nature has already certified you, just like I can give you an example. A girl is menstruating, a girl is ovulating, because in the menstruations I told you, few of the previous menstruations cycles may be without ovulation and ovular cycles we called it. And at that time, they are performing our duties, but they are not able to reproduce the life. But ultimately it comes after one or two or three or few cycles. The same way, sometimes the spermatozoas are not fully matured, and in the initial stage, and ultimately as the child grows stronger, bigger, brave, all these things, and then the hormones, they increase the production of the spermatozoas, production of the healthy, active, motile spermatozoas. But in the previous sections, you can say it is not sufficient. At that time, uh, he may not be able to reproduce a life. But I'm just in general taking, when there is a menstruation, when a girl is menstruating normally, or when the person is having normal seminal discharge with the spermatozoas, it means nature has certified you that you are now competent to reproduce the life. The main purpose of this life is to produce life from life. All other professions, all other duties are the allied duties, helping duties. Why uh, why we will do the jobs? Why will Because a body needs food, shelter, clothing. For that we do that. But ultimately it's limited. But we are increasing in our wealth. Our purpose is to create life from life. That is why we need to increase our wealth. That is why we need to work hard. That is why we are working continuously. We are producing life from life. And I'm saying, when a girl is menstruating, when a boy is having seminal discharge with spermatozoas, it means the nature has certified you for the purpose of producing life from life. This is what we can explain that one, and it's all because of the hormone production. Hormone production is at that time. But if a the social society may not allow you to do this normal function of producing life from life at this age, means the social society has limited our marriage age. That no, a male child cannot marry until he is 21 years old. A girl cannot marry until she is 18 years old. But the nature do not follow your rule. You are making your rules according to your demand, according to your, because population is increasing, and you do not want to do that. That's why you are creating the means that no, the marriage age should be increased more, that a child should be 25 years of age, a girl should be 21 years of age. Time to time we are increasing, but the nature has certified long back that this girl, this boy is now certified for its purpose of life. And purpose of life is to create life from life. It means it means we are going against the nature. And when you are going against the nature, sometimes it is overburst. Sometimes it is out of control of your power, and you adopt some means which are considered by your society the illegal means. And when you do illegal means for discharging of your hormones and all that, then ultimately you may suffer from, you may be attacked for those conditions which are known as STD, sexually transmitted diseases, through the genital organs. May girls or boys both can be affected. Any of the affected person can infect the other sex by sexual relationships. Or in this way, because it's not society permitted. In that way, you do secretly. When you do secretly, you do not know. There is no choice for that one. In that conditions, ultimately, you may be attacked with the diseases, and those diseases which you suffer from, sexually transmitted diseases, these are known as STD. And suppose if you are married, why you will adopt the illegal means? You will not. But if you are having, you are not married, and your hormones pressurize you mentally and physically, and you do something which is considered by the society illegal, not by the nature, by the society illegals, and then all these things happens, and you may suffer from the STD with multiple partners and all that, whether you do not know of any of the partners that if he is having any disease or if he is not having any disease. So in this way, you may suffer. Though there are many more means, medical science has developed contraceptive means so that you can protect yourself, but even then sometimes all the measures fails, and then you suffer from all these things. So this is what I can say about the pre-adult age, that this is also a warning sign for you, that you should be knowledgeable about all these things and not to suffer from the STDs. After that, the main major things we have discussed in these lectures is the injury. This life is a very carefree life. Do not bother if it's healthy. If it's healthy otherwise and performing all the duties of the young boys, riding, running, all these things, carefree, carefree from eating, carefree from working, carefree from doing exercise, carefree from riding. Everything goes beyond the limits. And ultimately, when you go beyond limits for any function in your life, you may suffer from accident. You may have an accident or fractures and all these things. So this is the measure. An old person will not do like this thing. Or even the young person will be guided by the parents. No, you are not to. You're not to do this thing. You're not to ride this motorcycle. No, you cannot do that. But when you are at pre-adult age, parents says, "Oh, now you are adult. You are no more child. You are responsible now. Do your duty, whatever you think better. Do according to that, whatever you think better." And ultimately, he becomes out of control. And sometimes this brings up different kind of accidents in his life. So accidental injuries, all these things may happen at this age, and the number of the cases which are reported in the hospital is more than any other age, that is the pre-adult age. So in the pre-adult age, more accidental cases are coming because of this negligency happens in this way. The second thing, the infectious diseases, it's also the carelessness. When you are careless to eat, when you are careless to eat, careless to habits, different kind of habits, ultimately immunity may be infected. Immunity becomes weak, and under those conditions, you may suffer from the infectious diseases. Weak immunity can catch up any type of infections at this age because you are carefree. You you are carefree. You do not bother about anything, and even eating, you do not bother for eating anything. Sanitations, all these things you are carefree. And under those conditions, this carefree life, pre-adult age, carefree life may be affected by the various diseases you are called as infectious diseases. And most of the infectious diseases may bring up nausea, vomiting, diarrhea, dysentery, IBS, irritated bowel syndromes. Because whatever you it is presented, you eat that. Whatever you like, you go and fast food and everything. You you are overwhelmed. Under those conditions, you do not know about that diet, whether your body will accept that one or not. If you are taking home food, your body is familiar with that food, and your body is producing required, you can say, the enzymes to digest that one. But if you are taking different foods, different varieties, you are trying every, and any time, sometimes it may happen that your body do not accept that. Your body is not capable of producing the enzymes to digest those type of foods. Under those conditions, you may suffer from all these things. This is known as IBS. And this IBS, after this IBS, sometimes the weak immunity or carefree life from the exposure and change of seasons, change of weathers, hot and cold. And if you are carefree, you may suffer from the respiratory type of diseases. The respiratory type of diseases, just like the bronchitis, pneumonia, asthma, anybody can suffer from that one because you are careful. But the weak immunity sometimes, or sometimes the repeated exposures of all these things, immunity cannot be at that. Immunity cannot safeguard you being weak, and you are not healthy. You are no more healthy at that time. You suffer from the respiratory diseases, and the doctor says, oh, you are having bronchitis, or you are having pneumonia, or you are having pleurisy, or you are having asthma. So whatever is concerned with the respiratory diseases, you may suffer from that one. And after that, these are the general conditions. These are the general conditions. We had discussed about the obesity. We have discussed about the sugar. We have discussed about the depressions. We have discussed about the blood pressure and cholesterol and heart diseases. Mostly, you might have heard about that the peoples are playing in the grounds and they fall and they died. It's all because the basic thing is your diet, basic thing is your exercise, basic thing is your inside content in your blood vessels, and all these things you have to take care. But you are carefree at this age, pre-adult age, you are carefree. Under these conditions, you may suffer from this thing. And now there are some other conditions which a person may suffer even if he is not intended to, if he is not responsible for those things, just like the testicular torsions, as I told you in the previous lectures, that there are two testes inside the scrotum, and they are covered by the under the scrotum there is a tunica vaginalis layer and there tunica albuginea layer. That albuginea is the layer which forms the spermatozoas and which produce the testosterone hormones, and all the production of the testis is coming out of the testis, and that is known as epididymis. head of the epididymis, body of the epididymis, tail of the epididymis. That's a type of tube, you can say, and that type and tube is like a spring. It enlarges as much as it is filled. It is enlarging out, and when it releases from the testes out, sometimes due to injury or due to excessive constrictions, sometimes the testes are twisted, and when the testes are twisted, it's very painful conditions, serious painful condition. And we need at that time need surgery if ever it is possible, because every person is not competent to release these torsions of the testes, of the of the epididymis. So in this way, it's a painful condition, and sometimes with the injuries, a young person, a person at the age of a pre-adult age, may suffer from all these things, torsion. And there are some other important diseases at this age. After the injury, there may form a varicocele. Cell means tumor, collections. Vari- Varicose is pertaining to the veins. When there is a clotting outburst of the blood from the veins, ultimately, it forms a tumor. Ultimately, it develops in size, and that is known as varicocele. That's also a painful condition. Sometimes it may not be painful if the flow is going normally, and but it remains on the side of the veins. But that is a tumor, and ultimately, this varicocele is also a person at this age may suffer. The other thing I told you about the hydrocele, these are the diseases pertaining to the males, especially the male persons may suffer from these kind of conditions at this age mostly. But it's not a hard and fast rule that only at the pre-adult age they will suffer from the hydrocele, or they will suffer from this kind of conditions, and anybody can suffer from that one, anybody at any age. But mostly the hydroceles, these there is no age limit for that. Even the children may have the hydrocele, and even the pre-adult age may have the hydrocele. Even the old persons, adult life, they may have the hydrocele, because there are other various reasons for the production of the hydrocele. Just the diet, rice. Most things people are eating in the food is rice, and there is a collection of excessive fluid in the tunica vaginalis layer under the scrotum. I told you the outside of the testes are covered by the scrotum, and inside the scrotum there is another layer that is known as tunica vaginalis. That tunica vaginalis layer is a spongy type of layer. Sponge means it can absorb water. It can absorb more and more water, and absorbing more and more water means there is a obstruction in the venous passages. Means whatever is coming, if it's going back, it's normal. But if something is coming up, is not going back, then there will be accumulations. And that accumulation is only possible in this tunica vaginalis layer of the testis. And in this way, it may becomes a big, large, even kgs, multiple kgs, couple kgs. It may be a bigger testis. And that basically we say testis, it's not in the testis. It is in the tunica vaginalis layer, the outer layer of that one. And but because of the excessive fluid in that one, it may cause many problems in the obstruction in the circulations, obstruction in the vas deferens. All these things may happen, and everything wherever it is blocked, always it causes pain. Previously, hydrocele is not painful. In the initial stage, if it has started from injury, yes, it is painful. But if it has, due to metabolic problems, due to diet type of things, it has started increasing, accumulating accumulating water, excessive water inside the tunica vaginalis, it start increasing. It continue in increasing. That's in the initial stage may or may not be painful. Ultimately, the symptoms, just like the thyroid, goiter, when the goiter becomes excessive or large in quantity, it obstructs the breathings. then it's painful. Otherwise, it's not painful. The same way, the hydrocele, it increases in size. The size is a problem. Weight is a problem. Hanging weight is a problem. Otherwise, sometimes mostly the hydrocele are not painful. But if they are obstructing any pathway, blood vessels, or the vas deferens, or the epididymis duct, or anyway, it hinders, obstruct the process, internal process of the testis, it becomes painful. So in this way, this kind of things may happen at this pre-adult age, and we should be careful about this one. And on the other side, if we go from the male to the female sides, there are many more problems in the female sides. The first thing, which is common in both, that is sterility. They are not able to reproduce life, because the main purpose of life is to reproduce life, and both of them are not able to, may not be able to produce. Everything physical is normal, sexual life is normal, discharge may be normal, but that may be, in the case of males, they may be azoospermia. There is no sperm. Production of the sperm is in the inside tunica albuginea layer. In the tunica albuginea layer of the testis is responsible for producing the sperms and for producing the testosterone hormones. But if that is not working, functioning normally, ultimately the sperms are not produced. Or sometimes there may be obstruction for the passages for these sperms to go out from the testis on their route. If they do not go on their routes, ultimately a male person may become sterilized. He is unable. Now everything is normal. Whatever is going from blood to blood, going from testis to blood, and everything is normal. But the transportation of spermatozoa is not normal. The way is blocked. Under those conditions, with all the qualities, a person may be sterilized. A person may have sterility, the male sterility. Sometimes impotency may play a major role, but it has been verified that even a person is impotent, and if he is having impotence, is a physical action. It's a physical action, though it's also concerned with the hormones. But if the spermatozoas are coming normally, he can make pregnant any woman. But sometimes both things comes together. Sperms are not there, and even there is a impotency as well. A male person may be impotent or may be sterilized. He is unable to reproduce the life. On the other hand, for the females, there are many more conditions. As you know that I described everything, how this ovarian function is running, how the ovary produces the ovum under effect of follicular stimulating hormone, under effect of estrogen hormone, under effect of LH hormone, what's going on. All these things we have described in our previous lectures. In this way, if the function of the ovary is disturbed by any means, even cyst, even tumor, even torsions like testis may happen over here, because this ovary is attached by a ligament, ovarian ligament, to the uterus. And sometimes there are some problems in that, in the fixation of that one, that causes a severe pain. But most of the girls are having PCO, polycystic ovary. Cysts are formed regularly. Cyst ruptured and it brings out the ovum every month, but there may be multiple cysts. And there may be multiple cysts, and there may be complicating, causing a more pain in the menstrual cycles to the females. That is known as PCO, polycystic ovary. And that may be one of the cause for the infertility, means sterility. Lady, after everything developed physically normal, but she is unable to do that. to perform this regeneration life. Everything physically is normal. Everything is going, and family life is normal. But even then, she is unable to, because there are another conditions. Menstruation, ovulation is concerned with the hormones. If those parts are normal, even then there are some problems, that the ovum has to reach normally to into the fallopian tubes in a limited times, and it has to meet to the spermatozoa in a limited times, and then within a limited time of 21 days from the first day of last menstruation, it has to reach to the uterus to be inserted over there, and start the pregnancy. As I told you many times, how it happens, everything goes on. So all these things, if there be any problems in this cycle, in this routine cycles, under those conditions, it is not possible that a lady can be a child, can become pregnant under those conditions. Even everything is normal. Mostly doctor says everything is normal. Your menstrual cycle, your hormonal cycle, your luteal phase, your uterine phase, your ovarian phase, everything is normal. Even then, a girl may not be pregnant. Mostly after a marriage, we consider, if within 6 months a couple living normal family life is not getting pregnancy, it means a girl is not getting pregnant. It means something's wrong. But if after 1 year of togetherness, a girl is not getting pregnant, something is wrong. Something is wrong. Something is obstructing, and then we have to search out on both sides, male and females. And male side, I told you, we have to check that the normal spermatozoa, this semen is containing the normal spermatozoa, and the quantity of those one, as I mentioned you, 60 million minimum quantity we need, and out of those 60 millions, we need 80% active and motile spermatozoas. If they are not, sometimes it may cause a little problems. And after that, even during impotency, I told you, a person can make a pregnant a females, because the discharge, if there is a discharge, sufficient discharge of the spermatozoa and semen in the vaginal area, it may go to the normal route, and she may be pregnant. But out of that one, all these things we are considering the sterility, male and female, mostly at this pre-adult age, when a child, girl or boy, they get married, and all the parents hope that they will start reproducing new life. If knowingly, if by their own intention, she is not getting pregnant, that's a different story. But if they are not doing anything contraceptive type of things, and if she is still not getting pregnant even up to 1 years, there is some problem. We need to interfere medically to find out what are the reasons behind that, why a girl is not getting pregnant. Is there a male concern of the sterility? Is there a female concern in the infertility? So all these things we have to consider, and this question is mainly concerned, though people come after that age, when they become adult, and when they're 35 years of age, 40 years of age, when they do not get any child, they did not get pregnant, then they find out, oh, what to do now. But actually, this question is concerned related to the pre-adult age, when they get married early, when they get married, and after a year or so they are not having any issue, then it is questionable. What are the reasons behind that? So we are discussing about the diseases. What are the diseases of the pre-adult age? So this comes a main factor to discuss, that why a couple after getting married at this age is not getting the issue, not getting the pregnancies in this way. This is the main topic we have to discuss about that. And after that, aside from this pregnancy things, there are some other reasons. There are some other problems A girl may suffer, that is known as endometritis, myometritis, fibroids, molar pregnancies. There are many more things girls may suffer because of the hormonal problems, because of some or the other reasons. We have to discuss all those things systematically, one by one. That what are the reasons behind endometritis? What are the reasons behind myometritis or fibroids or the moles? Why the moles are forming? All these things we have to discuss in our next lecture, and that why these things are happening in the females, what are the reasons behind that, what are the symptoms of that one. So all these things we will discuss next. And even autoimmune disease, we will discuss in our previous lecture, next lecture. Tomorrow there will be a lecture in Hindi, because yesterday we have discussed this chapter in Punjabi. Today we have discussed this chapter in English, and tomorrow Radio Pravaz will be joining us from New Jersey, and his branch from the North Carolina. They will be also joining us, because they are delivering this, relaying these programs in Germany and in New Zealand and in various countries. And if ever anybody is listening call, that you can convey this message, that you can join with us. You can download the apps of Sabrang radio station, sabrangstation.com, www.sabrangstation.com. So you can join us, and every day this lecture is from 5 to 6 p.m. as California time, Pacific Standard Time, California time, from 5 to 6. Mm, uh, I am presenting this health education lecture series, how the life was created from life and how it was developing step by step. And we are giving this explanation to you, and teaching you about this life processes. And this radio station is a 24-hour radio station, sabrangstation.com, or in other words, you can say Sabrang radio station. But if you go to the apps, www.sabrangstation.com, then you will listen each and every program, because the program starts in the early morning with Gurbani. Mostly every day there is a Japji Sahib, but on Saturday and Sunday there is a Sukhmani Sahib part, and after that there is a Shabd Kirtan, and then after that there is a Bhajan Kirtan, and after that all your Ranga Ranga program starts. Entertainment program starts, filming songs and log geets by your favorite singers, favorite film songs, and all these are given step by steps, and all other programs are attached in each program. In between the each program, you will see skits for your entertainments. And ultimately, in the evening time, I come from 5 to 6 to present this health education lecture series. And after that, the morning shows are again repeated, so that those who cannot listen in the morning time, they can listen in the evening time as well. So this is the 24-hour routine of the Sabrang radio stations. You can listen it, you can be entertained by Sabrang radio stations. Though these programs, if they, even someone cannot listen on these Sabrang radio stations, he can listen to, he can be a friend with me on Facebook. These lectures are on Facebook. Homeo medicine yahoo.com email address, or homeo health education lecture series. By the name of health education lecture series, you can join me on YouTube. And ultimately, on YouTube, there are thousands of lectures from head to heel for different diseases, for different criteria, for different your answers. All these things are there. You can go to there and you can find out your answers of your sickness. But even if you have any question presently, you can send me an email, homeo medicine. HOMEOMEDICINE or you can call me at 408 687 1899 to get your answer. Or if you want to be treated by a scientific homeopathic approach, then you can call me 408 687 1899. Rabraka, God bless you all. We'll see you tomorrow at the same time from 5 to 6 in Hindi program. That will be a Hindi lecture, so that if anybody cannot understand in English, if anybody can understand Punjabi, he can understand in Hindi as well. So tomorrow program will be in Hindi. Rabraka, God bless you.